What is a posterior placenta and what are the implications of having it?
Hello, and welcome to our enlightening discussion on the topic of the posterior placenta and its implications during pregnancy. It's a common term you might come across in your ultrasound reports, but what does it really mean? And how does it impact both the pregnancy and delivery? Let's delve into these details.
What is the placenta?
Before understanding what a posterior placenta is, we first need to know about the placenta itself. The placenta is an essential organ that forms during pregnancy, acting as a life support system for your developing baby. It provides oxygen, nutrients, and eliminates waste from the baby's blood.
What is a posterior placenta?
Now, let's talk about the term posterior placenta. The word posterior refers to the back side. So, when we say a woman has a posterior placenta, we mean that the placenta is attached to the back wall of the uterus, closer to the mother's spine.
How is posterior placenta diagnosed?
The location of your placenta is usually determined during an ultrasound scan, typically performed around the 20th week of pregnancy. It's important to remember that the position of the placenta can change as your pregnancy progresses and the uterus grows and stretches.
What are the implications of a posterior placenta?
So, what does having a posterior placenta mean for you and your baby? Mostly, it does not cause any problems and is considered a normal placement of the placenta. However, there might be some effects related to this condition. 1. Feeling the baby's movements. Since the placenta is at the back wall of the uterus, you might feel your baby's movements more distinctly and earlier than in pregnancies where the placenta is at the front, anterior placenta. 2. Labor and delivery. A posterior placenta does not usually impact the process of labor and delivery. However, if the baby is in a posterior position, also known as back-to-back or occipital-posterior position, it might lead to a more painful and prolonged labor. Remember, each pregnancy is unique and outcomes can vary. Always consult with your healthcare provider for guidance tailored to your specific circumstances. So, there you have it. We hope this video has given you a clearer understanding of what a posterior placenta is and its implications during pregnancy. While it might sound technical and complex, remember that it's just one aspect of the incredible journey of pregnancy. As always, don't hesitate to reach out to your healthcare provider if you have any concerns or questions. Stay healthy and take care.